You've heard it over and over during this pandemic. We're all in it together. Mind you, there's also been some hoarding and, of course, some selfish and careless activity, too. Either way, to some extent, we're all putting our trust in one another to keep us all safe. Here to reflect on the history and psychology of social trust at times such as these, we're joined in Paris, France by Laura Spinney, science journalist and author of Pale Rider, the Spanish Flu of 1918 and How It Changed the World. And in Vancouver, British Columbia, Stephen Taylor, professor of psychiatry at the University of British Columbia and author of The Psychology of Pandemics, preparing for the next global outbreak of infectious disease. And it's great to welcome both of you to our airwaves tonight here in Toronto, Ontario, Canada. Laura, I want to start with you by asking, how would you characterize what a pandemic brings out in most people?
I think from my historical research of what happened in 1918 and also from having lived through this actual pandemic, that I'd have to say it brings out the best and the worst in people. You saw that then, you saw people sticking together, helping people, even though it wasn't necessarily very rational in a situation of contagion. The same thing today. And you also saw the stockpiling, the xenophobia, the profiteering, as you mentioned.
Stephen, when there is a global pandemic, the likes of which we saw a century ago and now again today, what sort of pressure does that put on the level of social trust we have for one another?
It puts enormous pressure on because in order to manage a pandemic, as you know, we all have to agree to do things the health authorities suggest that we do. We have to agree to engage in social distancing. We have to agree to wash our hands and follow basic hygiene and so forth. And if people don't trust the health authorities, they're not going to follow what is being recommended. So social trust is vitally important.
Laura, in your book on the Spanish flu, you wrote, quote, "Your best chance of survival was to be utterly selfish and jealously guard your hoard of food and water and ignore all pleas for help." Did much of that happen?
No. And that's what's fascinating. I mean, that would have been the logical approach. That would have been the way to ensure your own survival and actually everybody else's as well. Because if everybody did that, there would be no transmission of the disease. There would be no contagion. But in fact, people reached out to each other. They helped each other. There's a story from South Africa of the mother of a family taking the baby of her white neighbors because the parents were both ill and couldn't breastfeed it, and she breastfed it until the white mother was able to. So there was a reaching across color lines there that didn't usually exist. You see amazing acts of kindness in the thick of the pandemic, even though it wasn't necessarily the logical thing to do.
And they did it despite knowing that it could cost them their own health, eh?
They did. I mean, I think there's a sense that of what some psychologists have called collective resilience, that we might come out of this better if we all stick together. And maybe there's some truth to that. There's perhaps more truth to that in a different kind of natural disaster, say an earthquake or a fire or something. But when contagion is involved, the rules change slightly, and yet people still stick together, at least in the thick of it. That tends to break up either side, but we can talk about that maybe.
Stephen, that term, collective resilience, do you see it coming out now during this global pandemic?
We do, and you see that in all natural disasters as well. That trauma, when it happens to a community, people do pull together to help one another. And in a sense, it gives people a sense of control, that they're actually doing something to feel like they have some kind of agency over whatever challenge they're facing.
I guess I want to figure out, Stephen, how much of this happens on a kind of a broader macro societal level, and how much does it come down to our particular individual temperaments? Have you been able to figure that out?
It's a mix. Humans are fundamentally tribalistic. So we come together and help out one another in our community, but you also see the rise of racism and xenophobia. But we do find individual differences. Some people overreact to the threat. They become highly anxious and withdrawn, whereas other people underplay the severity of the pandemic, thinking the whole thing is overblown. And they're the people who don't wash their hands or don't engage in social distancing. So you see a whole gamut of responses.
Laura, I wonder if I could just go through a few quick examples with you from your book. And I'm going to guess that 99.99% of the people watching this right now were not alive when any of this stuff happened. So we're going to go down memory lane here for most of us. 1919, Rio de Janeiro. What happened?
Well, Rio de Janeiro was really, really badly hit in the lethal second wave of the pandemic, which was the previous autumn, 1918. What happened in 1919 is really interesting, though, because it was Carnival, as every year, in February. And the flu hadn't gone from the city. It was still there. People were still falling sick and dying, though it was the tail end of the epidemic and it was leaving. But you can imagine there was a very strange atmosphere in the city. The theme of that year's carnival was divine punishment, and more people attended it than ever before. And it's really strange. You're reading the historical records, you have to read between the lines, but it looks like it kind of degenerated a little bit. It was this huge party, perhaps an orgy. The rules broke down slightly. And I don't know, maybe a sense of we're still alive. Things got out of hand, and it became this huge party, orgy. I don't know. Something similar is supposed to have happened after the Black Death, by the way, in Italy in the 14th century. Maybe it's life reimposing itself over death, but it was a strange time indeed.
Stephen, do we want to say the more things change, the more they stay the same? I mean, look at Brazil 100 years later, and they're kind of, I mean, their governments, their people are almost acting like nothing's going on, like there's no reason to change anybody's behavior right now.
Exactly. All the things we're seeing in this pandemic, we've seen before in previous pandemics. The big difference is this is the first pandemic in the age of social media and digital interconnectivity. So everything is happening bigger and faster, but the same fundamental phenomena that we saw during the Black Plague or 1918 pandemic, we're seeing here, including fatigue with social distancing. We're seeing that right now. People are getting sick of being in lockdown, particularly the younger people, and they're craving to get out to attend demonstrations or carnivals or social gatherings. And of course, there's the concern there that could precipitate a second wave. And I guess also it's a part of wishful thinking too that we saw in previous pandemics, wishing the whole thing would be over and you could get back to socializing with your friends and life as it was before.
I've never thought that wishing away was a particularly good medically proven way of doing anything.
It's not, but it's very commonly used. Wishful
It's
thinking
very commonly used.
A very common coping strategy for people.
I mean, in 1918, for example, a lot of people turned to prayer. Even some, even very scientific people, people were desperate. They'll do anything that might possibly work to bring normality back.
Stephen, as we look back through the history of pandemics, how much racist scapegoating happens, blaming one particular group for the disease, for example?
It's sad to say, but a lot of racism. When people feel threatened with infection, you tend to see a rise of racism. It's a way of, if you think of it as an evolved mechanism of protecting oneself, because historically, the lethal diseases came from foreigners. If you think about the European explorers to the Americas, they brought influenza and smallpox and so forth, which decimated the locals. So it's an evolved mechanism. That doesn't make racism right. Racism is not right, of course, but it does happen. During the Black Death, there was racism against people of Jewish ancestry. During SARS, racism against Asians. This time around, racism against Asian people. It's always happened, and particularly the people who have pre-existing racist attitudes and the people who are very frightened of infection. The people who are very frightened tend to react with xenophobia.
We would like to think 100 years later we're a little more enlightened at this time, but are you still seeing plenty of evidence that, for example, because this coronavirus started in China, that Asians in general and Chinese people in particular are facing the same kind of stress now?
It's the same thing over again. It's sad to say, but the racism is the same, and in part, it's part of it is due to community leaders too. Community leaders who refer to the coronavirus as the Chinese virus. That's going to incite racism. We're seeing racism the second time around as well.
Although it's interesting, Stephen, if there's one group that we sort of know is more likely than not to contract COVID-19 by virtue of the kind of work that they do, it's healthcare workers. And yet they have become hardly scapegoated and certainly not avoided. They've been celebrated, people banging their pots and pans at 7 o'clock every night and cheering them as they come off shift. I know that happens in Vancouver where you are as well. How do you explain that?
Well, it's complicated. Back during the SARS epidemic, there was massive discrimination against healthcare workers. This time around, what we're seeing is complex. It's one thing to get out on your balcony and cheer healthcare workers. That's cheering at a distance. You're in the safety of your apartment. It's a very different matter altogether to get into an elevator crammed with doctors or nurses. So we are seeing avoidance and discrimination of healthcare workers. At the same time, we're also seeing cheering and support. But these people they're protected. They're separated from healthcare workers. So it's a bit of both.
Right. Laura, let me impose upon you to go back to South Africa, where you gave us that anecdote a few moments ago. And as opposed to one anecdote, can you talk to us about whether or not there was and remember, this is in the thick of apartheid, can you tell us whether there was a more general peacemaking between white and black populations in South Africa related to the pandemic of 100 years ago?
Well, I think South Africa is a really interesting example because it illustrates this idea of collective resilience really well. Because the idea of collective resilience is that it only really holds when there's this external threat to everybody and everybody feels like they're in the same boat. So in the middle of what was called Black October in South Africa, the worst second wave, you saw this reaching out across color lines. You saw this coming together and this kind of heartwarming, I suppose we would think of it, behavior. But then when the pandemic started receding, then that resilience started to break down too. And in fact, the Black community and the white community started mutually accusing each other of having brought this disease in. And it's from the early 1920s, once the pandemic has receded, that you see the first enactment, in fact, of the laws of apartheid, the first segregation of cities. That had been talked about before, but it was only after the pandemic that passed into legislation.
I see. Okay. So the worst of apartheid was, in terms of a
still to
legal
come.
system, was still to come. I see.
Yeah.
Stephen, there may be a greater, excuse me, there may be a greater sense of togetherness nowadays, but again, based on history and based on what you know of human nature today, does that kind of thing last?
That's a big question. We all wish this altruism that we're seeing is coming together. We would hope that it would last, but I think things will go back to normal once this pandemic passes. The psychological reactions to pandemic are dynamic. They fluctuate and change over time. And initially we saw the selfishness of hoarding behaviour and so forth, and the coming together of altruism. And as the pandemic recedes, sad to say, we probably will see a reduction in altruism as people get back to their self-focused, busy lives.
Well, Laura, let me get you to weigh in on that from this angle. There are a lot of people in this society today that other people are taking a second look at in a different way. And by that, I mean personal service workers, first responders, the people who stock groceries on our shelves, truck drivers who get stuff along highways of this country and into those grocery stores. Again, based on history, once the pandemic is over, are we going to go back to sort of marginalizing and thinking less of these people who we're now calling heroes?
It's a really good question. History teaches us, unfortunately, that we do tend to forget as soon as the pandemic's passed. But I think we sort of learn, we just learn a little bit each time and we get a little bit better. So, for example, now in many countries, there are official pandemic preparedness committees. And assuming they still continue to exist, I would be very surprised if they didn't take on board the notion that if we don't look after those key workers, then everything falls apart. So hopefully those concepts and ideas about protecting those workers, supporting those workers, giving them all the equipment they need will get built into a pandemic preparedness plans in a way that they haven't perhaps sufficiently this time around. And by the way, just to go back to the point about xenophobia, the Spanish flu is the iconic example because it did not start in Spain, but the Spanish were accused because their press was uncensored, unlike the warring nations, and so they described the first cases in Spain, whereas other nations kept those quiet. So the name of that, the worst pandemic in modern history, is a sort of monument, unfortunately, to the xenophobia that comes with pandemics.
What should we have called it if not the Spanish flu?
We don't know where it started. And in fact, it's a very bad idea really to label anybody and to point the finger at anybody. Unfortunately, you need a name for the thing at the beginning so that you can talk about it. But at the beginning, you don't really understand it very well. So it's exactly then when you shouldn't be naming it at the same time in a way. It's good that we managed to keep it rather bland this time. That's a good thing.
Although in some ways we keep doing that, right? I mean, there is something called MERS, the Middle East respiratory syndrome. We have, well, needless to say, there's a certain president who kept calling this the Wuhan virus or the China virus. Um, we don't seem to be getting any better at not labeling these things or not focusing them on a certain country. Isn't that fair to say?
I think it's a really fine line because there can be useful information in a name. If it came from a certain region, maybe it tells you about the intermediate host or something to do with that region. But you want to be able to convey information that's useful about it without stigmatizing anybody, especially when you don't know the actual cause or the path it took to humans. So it's a very difficult problem. And even the WHO, which issued guidelines in 2015 about how to name diseases, or rather how not to name them, how to avoid stigmatizing people and places, hasn't quite cracked it. It's a very difficult problem.
Stephen, I want to ask you about masks, because masks have in some respect become, the big indication about whether or not you're a person of altruism or empathy, because of course the mask is not meant just to protect you, it's meant to protect others from you having droplets hit them. So what are you seeing out there right now in terms of how accurately mask use reflects our empathy for one another?
It's a complex issue. And part of the problem is our health authorities have been inconsistent on the wearing of masks. Initially, we were told we shouldn't wear them, there was no need. And now we're suddenly being told everyone should wear masks. And the research hasn't changed. There's no solid research that shows that masks are beneficial. But, it logically makes sense to adopt a better safe than sorry approach. So there's that component to it. There's also the cultural component. Mask wearing is traditionally a cultural practice for Asian peoples. And so when you've got this rise of xenophobia, mask wearing gets associated with Asian people and can trigger xenophobia. And then to make things worse, when a person wears a mask, it's hard to read their expression. It's hard to understand what they're saying. So there's that sense of psychological distancing. And of course, mask wearing can be uncomfortable for some people. So for many reasons, people are reluctant to wear masks. And some people reacted with rebellion. They see being required to wear a mask as an infringement on their freedoms. And so they might reject mask wearing for those reasons. And on the other hand, you've got people who are very anxious about their health and are wearing masks even when they're alone at home. So you get all kinds of motivations and effects of masks.
Well, of course, for some in the disabled community, it becomes particularly problematic because if you're deaf and you're trying to read lips in order to understand what's going on in your world, and if everybody's all masked up, you're going to have a hard time understanding. But Laura, I wonder whether or not this debate took place in 1918, around the time of the Spanish flu.
It absolutely did, and it took on almost the exact same dimensions. Mask wearing wasn't compulsory almost anywhere. It was the only place it was compulsory, I think, was in California, not even in most of the US states. And people were relatively compliant to begin with, I think, but then basically the scientists started arguing about it. Did they work? Were they effective? Weren't they? And then over time, people's compliance started to fall off because people were falling ill anyway. They saw that it didn't work. And as Stephen said, people's patience wears thin with public health measures over time anyway, because they're just getting more frustrated with the restrictions on their lives. And then you saw the whole civil liberties thing come in. So there was anti-mask leagues, and it became a question of personal freedom. And then you saw leaders who forgot themselves in public, maybe a mayor's mask who fell for, was just dangling from his ear. And then people took that lead and everything started falling apart.
Stephen, let's talk about what happens to our trust for institutions and in particular government during a time of pandemic. What does it do? What do pandemics do to the level of trust people have for those things?
Well, people look to government for guidance. How serious is the threat? What should I do about it? And if the government is seen as being transparent and reliable, as being providing timely information and acknowledging uncertainties, people are going to trust the government and follow their recommendations. But if, on the other hand, if government is inconsistent, you're going to get a lack of trust. And so people are less likely to follow government recommendations.
Laura, here's a quote from a book by a guy named John M. Barry. The book is called The Great Influenza, the story of the deadliest pandemic in history. And he writes, "The final lesson of 1918, a simple one, yet one most difficult to execute, is that those in authority must retain the public's trust. The way to do that is to distort nothing, to put the best face on nothing, to try to manipulate no one. Lincoln said that first and best, a leader must make whatever horror exists concrete. Only then will people be able to break it apart. In your judgment, has that happened in the year 2020?
Actually, I don't think Abe Lincoln was the first to say that. I think John Locke said that in his discussions of the social contract. But it's absolutely correct. It was true in 1918. It's true today. That trust between the government and the authorities and the people is absolutely crucial, and it's a delicate thing. It can die or wane or wax, all the time, and you have to nurture it. And of course, we're seeing it today. If people don't have trust in their authorities to be leading them well, then they won't comply with the measures. And the measures should not be mandatory. It's much better if people comply voluntarily. But for that, they have to be A, informed, and B, properly engaged. So information and trust are absolutely crucial. John Barry is completely right.
Could I get you to weigh in, Laura, on which leader, political or medical or whatever, in the world today has been the best at practicing that advice, and who's been the worst?
I'm not sure that's a fair question. So if you're asking me who has given the clearest messaging, who has been most engaged with people, I can think of several examples. There's a health minister in Kerala, Shailaja Teacher, who did a great job. There's some of the female leaders who've been very clear and very calm all the way through. And then there are some governments who've given some confused messaging. And I don't necessarily think it's all their fault, because the scientists are changing their minds all the time too. But transparency isn't necessarily about always giving the same message. It's about saying, I'm following the advice, you're hearing it from me first, I'm keeping you updated, you're hearing what I'm hearing as soon as I hear it, full disclosure. And we're all in it together again.
I notice you didn't want to name names on the second part of that question. She smiles and we move along. Oh, okay,
Mr.
Stephen.
Macron was very good.
Okay. She says in France right now. Okay, good enough. Stephen, how about you? Same question. As you look around the world, who's done great? Who's done lousy?
I don't think any leader has done a perfect job. I don't think that's possible. But I think Justin Trudeau has done a fairly good job. Early on, he's sending out the message that he's listening to the people, he's acknowledging socioeconomic concerns, because that has been one of the big impacts of the coronavirus, the effects on people's livelihoods. So he's been doing that, leading by example, generally, self-isolating, wearing a mask, but not being afraid to pull punches. Early on, you might remember when people were violating social distancing, he sent out the message, and that message was, go home and stay home. Emphasizing the importance of social isolation. So by and large, I think he did a great job. In comparison, south of the border, I don't think President Trump has done a very good job at all. He's pushing to open up the economy prematurely, circulating conspiracy theories, prematurely tweeting about hydroxychloroquine as a treatment, or the bleach conspiracy theory as a treatment, which has had all kinds of unforeseen consequences. So, and he's not alone. Some other leaders haven't done particularly good either, going out to the pub, shaking hands with people, underplaying the whole thing, and then getting COVID yourself. And you know who I'm talking about there.
That might be Boris Johnson, the UK PM. You might be referring to there.
And also the Brazilian leader as well.
Yes, Bolsonaro has not been covered in glory either. Stephen, have countries with higher levels of social trust actually had better outcomes during this pandemic?
That's really hard to say, because there are so many factors at play. So I really couldn't say at this point.
Okay. Laura, let me point you back to your book, where you point out that Indigenous elders in Alaska advised survivors of the Spanish flu to, and I'm going to use the word here, I hope I've got this word right, Nalanguarluku. That is the Indigenous word from Alaska, and the gist of it is, pretend this never happened, as in that's the best way to cope with this. Have I got that right?
I was talking then about the Yupik of Bristol Bay, who were, 40% death rate. So they were completely traumatized by that pandemic, which decimated their communities. And I thought that was really interesting. The advice of the elders to the young people afterwards, and also after previous epidemics that they were exposed to, was to pretend it didn't happen. That's what that word means. And so, that, first of all, obviously that speaks to the suffering, the way they thought it was best to move on after that disaster. There was just no speaking about it. There was only rebuilding and looking to the future. But I think it also speaks to the issue of memory, and why our memory of that disaster is so patchy and so poor, really, compared to some of the other disasters of the 20th century. It is that those people who were worst affected, either willingly or unwillingly, were deprived of a voice.
Stephen, in our last 30 seconds, can I get you to weigh in on whether you think by the time we get closer to the end of this thing, forgetting it will be a big part of our coping strategy going forward?
It's called emotion-focused coping. So it is a coping strategy people use when they can't actually practically solve the problem. I don't think that's going to work this time around, because chances are that COVID-19 is here to stay. And if not COVID-19, then there will be another pandemic by some other infectious agent in the coming years or decades. So I don't think we're going to forget this as easily as we forgot, say, SARS or Zika or some of the previous pandemics.
Well, I'm certainly not going to forget this conversation. You two were fascinating and we learned a lot. So thanks to Laura Spinney and Stephen Taylor for your time on TVO tonight. All good wishes to both of you.
Thanks very much.
Thank you very much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.